Welcome to Sex with Rebecca, a show geared towards relationships and sexuality. They'll help you enjoy your relationships more than you ever thought possible. So send us your difficult questions and we'll bring you expert answers unlike anywhere else. On tonight's show, we'll be discussing male sexuality, answering an email on pageantry sex, and giving you some hot reasons for getting hot and bothered. Let's begin with our discussion on men's sexual health with our very special guest, Dr. Dean Elterman. Dr. Elterman is a urologist and men's health expert at the University Health Network and U of T. He works with both men's and women's sexual dysfunctions, offering exclusive new treatments for prostate enlargement, vaginal rejuvenation, erectile dysfunction, and lots more. Welcome, Dr. Elterman. Such a pleasure to have you joining us.
It's
tonight.
wonderful to be here. Thank you for having me.
Well, thank you. You've got all this great new stuff. Really excited about it. Since I get a lot of questions regarding erectile dysfunction, aka ED, can we maybe start there as in what are the criteria for diagnosis?
Right. So erectile dysfunction, or ED, first of all, it's a very common condition. It affects over 50% of 50-year-old men. So what is it? It's really the inability to attain or get or maintain or keep an erection sufficient for sexual activity. A lot of men get sort of focused on the idea that you have to have an erection firm enough for penetration. And I would say that that's just one definition of an erection. I think there's a lot of great ways to be sexual and to be intimate with partners without having a firm penis for penetration. But that being said, erectile dysfunction is really just the inability to get or keep your erection.
Firm enough for penetration and then obviously maintaining it.
Well, for sexual activity, however you want to define it.
Mm-hmm.
Right.
Okay. So you said about over 50% in 50-year-old and older. Generally, what are the percentages? Let's say in younger people, for instance.
So, I mean, it definitely does occur in younger people in their 20s, 30s, and 40s, but the reasons are often a lot different. Most likely, if you're older, the major reasons are a blood flow issue. Whereas younger, it's more likely going to be a psychological or psychiatric condition that's leading to the erectile dysfunction or sexual dysfunction, because really the plumbing down in the penis should be working pretty well if you're 20 years old.
Exactly, and those are the people that can go on and on and on. But I'm glad that you mentioned the cardiovascular stuff. I've had gentlemen who were talking about erectile dysfunction, and it seemed like that's what it was related to. And they kind of went and saw their doc, and they literally had other issues, sort of prevented a heart attack, if you may, because there's no such thing as a penile attack. So I appreciate you mentioned that. So some of the common reasons, you talked about cardiovascular. Maybe you can cover some of the other reasons as well.
Sure. So the most common reasons are going to be things related to cardiovascular disease, and you make an excellent point. If you have erectile dysfunction and you're, say, over the age of 50, this may be the early warning sign that you have something more serious going on, like heart disease, and this could precede or warn you about something major happening, like a heart attack or a stroke. Other risk factors might be diabetes, or poorly controlled blood sugars or blood pressure, other sorts of medications that you may be on for other unrelated conditions can give you a side effect of erectile dysfunction. And of course, there are all the psychological reasons: stress, anxiety, poor sleep, poor diet, putting on weight. They all can contribute to erectile dysfunction.
And, you know, some of them are also transient. Like I think of when a lot of my clients, when they're stressed out, naturally cortisol goes up and the cardiovascular system starts to, the blood vessels in the penis start to constrict. And your typical performance anxiety, as soon as they're worried about it, is probably going to happen. So I'm glad that you covered that, because a lot of times the partner says, you know, my husband or my boyfriend or whatever isn't interested in me sexually anymore. And they're just distracted or stressed. So I'm glad that you covered the entire gamut. So how can you, is there sort of a way of telling whether it's psychological or physiological in nature when someone is experiencing erectile dysfunction?
Yeah, well, I think a really good assessment by a healthcare professional is necessary, right? We need to rule out other causes. We need to make sure that there aren't things like blood pressure, sugar issues going on. And also, if we're really going to get into the crux of men's health, we have to address the psychological aspects of sexuality. If a man is stressed, if there's friction in the relationship, that's going to be manifested in sexual dysfunction. So I think the bottom line is go see a doctor and don't ignore it, because it could be a sign of something much more serious going on.
Absolutely. So it's always important to rule out the physiological stuff. And I also find with a lot of my clients, they'll say, I'm waking with the morning wood, I get erections through the night. When I'm on my own, I'm fine. It's just with my partner. So that's sort of telling in and of itself too, that what's your relationship like outside the bedroom, if it's kind of manifesting that way inside the bedroom.
Yeah, I mean, I think for me that's a big tip-off. Guys come in and they say they have no problem when they're alone masturbating, but when they're in an intimate situation with a partner, whether it's a long-standing partner or a new partner, that performance anxiety is really what manifests. Yeah.
And the other thing I'm also finding more and more, since porn is so easily accessible and it's no longer stills. I mean, this is stuff that's rewiring your brain. It's amping up what you're getting. So I'm finding more and more, and especially with younger men, but also with older men, if they're hooked on porn and they're hooked on masturbation, that is also starting to cause erectile dysfunction in partnered sex. So do you have any comment on that?
Well, we're definitely seeing a lot of younger men, millennials coming in, really worried about their sexual performance. And I think they have a really unrealistic expectation of what an erection should be, how long it should last, what a sexual encounter should look like. And I think pornography is probably driving a lot of that unrealistic expectations.
Absolutely, because I mean, these guys, they have like humongous penises and they've been selected that way. And when they think that they can last for, 10 minutes, 20 minutes, 30 minutes, they don't know it. That could have been filmed over 2 days for all they know. But they sort of look at it and they have that expectation. And that must also build into, the body image anxiety and performance anxiety in general.
Oh, yeah, absolutely.
Men are sort of on display for the first time. It used to be just women's bodies had to meet particular criteria, but with porn there's lots of pressure there as well. Now, I understand that there's different ways of treating it. Maybe you can tell us what are some of the common ways and what is a special new technique that you have?
Right. So once we've ruled out, serious medical things, the standard has always been pills, at least for the last 20 years since Viagra came out. So the pills work very well, but they're a Band-Aid solution. You take a pill like a Viagra or Cialis or something like it about an hour before you want to have sex, and you need sexual stimulation in order for it to work, and it'll last for a couple hours in terms of staying in your bloodstream. And that's really the standby for most men, and it'll work in the majority of cases. In really tough to treat cases, we have other types of things. We have injections. You can take a small amount of liquid medication and inject it into the side of the penis. It sounds worse than it is, and that's really for hard to treat conditions. But we have new things coming out now. So there is a treatment now called low intensity sound wave therapy or low intensity acoustic. It might be known as ED1000, and there's a number of other terms, and I think it's actually great. There's really good science behind it. I'm offering it in my clinic downtown, and what it is it uses sound waves directed on the penis to cause new blood vessels to grow. So imagine it's like a highway and there's a traffic jam and the blood's not getting into the penis. We're actually going to build new roads and new routes to get the blood flow going. So the majority of particularly older men who don't have good blood flow to the penis, we're going to regenerate brand new healthy arteries so that you're able to get a good firm erection.
That's incredible. So real quick, what does that look like? How many treatments? So they come in, and I know your clinic is one of the few that offers it. So they come to you, how many treatments would they need for something like that?
Yeah, so we offer ED1000 at University Urology Associates downtown, and men come in. It's only a 30-minute appointment. There's no preparation, there's no pain, there's no recovery. They come in twice a week for 3 weeks, so that's 6 treatments, and then there's a 3-week break, and then we do another 6 treatments over 3 weeks, 2, 4, 6. So it's a total of 12 treatments over 9 weeks.
That's awesome, and you've helped them in such an astronomical way. Thank you. I have more questions, but since I imagine this is not covered by OHIP, do they still need a referral from their physician?
They don't need a referral from a physician. It's not covered by OHIP, but they can contact University Urology Associates or ED1000 directly. And they don't need to talk to their family doctor. They can come right on in and get an appointment and start the treatment right away.
Thanks, Dr. Elterman, for all that important information. Coming up, no pun intended, premature ejaculation and the truth behind size. So don't go anywhere. Welcome back to Sex with Rebecca, a show where we bring you expert advice on important matters to help your relationships be more intimate, exciting, and emotionally fulfilling. We've been discussing male sexual health with our very special guest, Dr. Dean Elterman, a urologist who specializes in various aspects of sexuality. Let's get right into a discussion about something that many guys have wondered about at one time or another: size. What's the average penis size?
So the average penis size is about 3 inches soft or flaccid and about 5 inches or 12 centimeters, give or take, erect. I think the bottom line is this. There is a wide variety of penises, just like vaginas. And, men really need to learn to accept the penis that is given to them. As a urologist, I'm a surgeon. I do penis surgery, but it's necessary surgery. And when men come in concerned about their penises, and particularly size, the bottom line is that there's nothing we can really do about it. There's a wide variety in terms of the range of appearances and widths, girths, lengths, and they all work just fine. And there's nothing really that a urologist or anyone can or should do to a normal penis.
I'm really glad that you said that, because apparently you can screw up things more often if you're trying to mess with size. And the interesting thing is, most women don't care as much about size as men do. And because that's just not how we think about it. Some women may care, but like, we never have to say about our parts, oh my gosh, look, it's a whole inch and it's really pretty and really huge. We don't do that to ourselves. Right. So we certainly don't need to do that with men. Now, another myth is, about showers and growers. So can you kind of comment about that? Because it's my understanding that the tiniest grower can be pretty close to a big shower.
Yeah, there's really no relationship between how a penis looks when it's flaccid or soft and when it's erect. And so, again, men shouldn't get too preoccupied with how their non-erect, flaccid, soft penis looks, because it's going to grow and is going to work. And there's really no relationship between how it looks in the shower and when it looks when you're performing. And so men really shouldn't get too hung up or worried about it.
I totally agree. And the interesting thing is, when I have older clients, they say, I worried about size. Now I just want it to be good and hard. And I'm totally happy with it because I've never had a problem with it. So speaking of size, those people who do go for enhancement, what kind of problems can they run into? Because as a urologist, I'm sure you do a lot of corrective surgery.
Yeah, so, there is a field of urology that does look at male genital enhancement. But there are a lot of problems with this. First of all, it's very difficult to find a urologist in Canada who does it. It's really not medically necessary. The cosmetic results are often very poor, and you can really deform and mess up your penis. So I've seen a lot of men who've gone overseas to Asia, to Europe, Eastern Europe, and they have surgeries and they come back, and there's a lot of complications and problems, and we try and fix them. So if I could give a word of warning and advice, it's don't go for penis enhancement surgery. It's not going to give you the outcome that you expect. It's really, really rare to meet the expectations and to be a satisfied customer with these types of operations.
I'm so glad you've said that, because so many people get hung up on that and they're disappointed afterwards, but they don't share that part with anyone. So it's sort of a silent thing that people don't know about. So I appreciate you sharing that. So what I'm hearing about then from you is that most guys shouldn't really be even worried about size. So let's talk about something else that they worry about, i.e. premature ejaculation, since there seems to be a lot of confusion around that as well. I've even had guys coming to see me, they say, I'm only lasting 20 minutes. I'm thinking, great, that's like 15 minutes longer than most people are. But to them, it's a big deal. So how would you kind of define it? What percentage of men suffer from it? And what's the actual definition where it is considered premature ejaculation?
Right. So the average duration of actually having intercourse from the time penetration starts till orgasm is around 5 to 7 minutes. But about 40% of men will be somewhere between 2 to 4 minutes. So we're measuring this in minutes less than 10, for example. That's the average normal amount of time that you should have intercourse before you have an orgasm. Some men will have premature ejaculation, and the definition is less than 2.5 standard deviations below the mean, which translates to less than a minute. So if men are having an orgasm, they're ejaculating within a minute of starting to have sex, penetration, then that would be considered premature ejaculation. But that affects up to a third of men. So again, it's another really common condition.
Now, I've heard of agents such as Promescent. Maybe you can mention that, and if there's anything else that people can do for bona fide premature ejaculation, not trying to make yourself last for hours on end, but just from what you've described, what are some of the things that can be done?
So if you are lasting, a minute or two or less, and you're worried about it, there are pretty good formulations. So Promescent, for example, is a really good sort of topical anesthetic that numbs the penis. You have to be worried about your partner's vagina getting numb, for example, but again, it's very effective. For really extreme cases, we can actually prescribe medications that can prolong how long your erection lasts or orgasm, but these are antidepressants and they also have their own side effects. I think also just looking at sort of psychosexual counseling is also really important. There are techniques about sensation, getting in touch with your body, stop-start technique, a lot of things that I think a really good sexual counselor, sex health counselor, would be able to help men with.
Yeah, I do a lot of that as well. We're just kind of teaching them better control, and they feel more and more confident. And even going back to Promescent, I don't know what your experience has been, but from what I understand, that it's the nice thing, if you do it 10 minutes early, you can actually wipe it down, so hopefully it doesn't transfer to the partner like some of the cheaper sprays and stuff does. What are some of the things that can cause PE?
We actually think that there might be a genetic component to it, so it's not a man's fault. Some men probably had a father, or it runs in the family. Of course, you would not talk about it at the dinner table, but there is probably a genetic component to premature ejaculation. I think also a lot of men who have sexual inexperience, so when they're early in their sexual lives, they tend to have premature ejaculation. And again, it could just be related to other psychological aspects of sex that are driving them to reach climax too early. And maybe the discussion we had about pornography is also driving some of that problem.
And some of the older gentlemen, they want to come before they lose their erection. So there's lots that could be going on. So definitely a dance between the psychological and the physiological. Great stuff, Dr. Elterman. Still ahead, other sexual concerns and new state-of-the-art treatments. So do stick around. Welcome back to Sex with Rebecca, a show geared towards making your relationships the very best that they can be, both in and out of the bedroom. We've been discussing men's sexual health with urologist and sexual health expert, Dr. Dean Alterman. Dr. Alterman, with easy access to porn, we were talking about some of the erectile dysfunction in younger men. Are you seeing more and more of that nowadays?
Oh, definitely. I mean, men are coming in and they're really worried about their performance. I think it is driven a lot by social expectations, pornography, what they're seeing on the TV, what they're seeing in movies, and they don't really have a good understanding of what is normal and what is super normal. Yeah, so we do have a lot of concerns coming in.
My favorite website to that effect is yourbrainonporn.com, and it has clips on how ED works. And so do you have any kind of suggestions for those people to sort of retrain the brain? I try to get them to do 90 days of abstinence, which is very hard for these people to do, sort of to reboot the brain, and also, give the dopaminergic system a bit of a break, etc. Do you have any other recommendations for that population in particular?
Yeah, well, I mean, I think that strategy is really effective. I mean, you need to sort of take a break and step back from whether it's a lot of pornography or whatever it is that you feel is setting the bar too high. As a urologist, as a surgeon, we often don't have the time, and so often, finding a really good sexual health counselor, psychologist, counselor like that is really important. So we rely a lot on the relationships we have with the other healthcare professionals to send men to really get good advice and help.
And also for people to kind of normalize and get rid of anxiety, because it is my understanding that 2/3 of family docs won't even talk about this stuff, even as they discuss other below-the-belt issues like colonoscopies and prostate cancer and whatnot. Speaking of which, I'd love to hear something from you about prostate health.
So prostate health is really important, obviously, for men and men's health. The prostate is a reproductive organ, and then certainly it starts to give men some trouble as they get into their 40s, 50s, and beyond. One of the most common things, aside from prostate cancer, is actually prostate enlargement.
Right.
And prostate enlargement results in urinary symptoms that are bothersome. Men are waking up at night, their flow is really slow, and that's a really common condition. In fact, there's a lot of overlap between men who have erectile dysfunction, about half of men, and another half of men, once they reach age 50, will also have enlarged prostates. So looking for new treatments for men to treat enlarged prostates is always a big area of interest.
Now you have something that, again, state-of-the-art stuff, cutting-edge stuff for that. Can you talk to us a little bit about it?
Yeah, so when prostates used to get enlarged, we typically give medication, and then there were sort of larger, a little bit more invasive surgeries. And as the years have gone by, we've refined it so men can come and now get laser surgeries. And in fact, there's something even less invasive, which is called a Gyro Lift. So again, we're offering something at my downtown clinic, University Urology Associates, called a Gyro Lift, which is a very quick procedure just with some sedation. And it's almost like little stitches that pull open the prostate and that facilitate flow. So you're in and out within an hour or so. You're not having to sleep overnight in the hospital. You're back to work the next day or so. And it's really revolutionized the way we treat men with enlarged prostates.
So it's just day surgery, and again, it seems
It's
like
not even day surgery. It's a small procedure where you're in and out within an hour.
That's incredible. It's amazing how all the new stuff, it doesn't have to be invasive. You don't have to have these massive surgeries. And some people, they worry about nerve damage and infection and all that. So it gets rid of all the iatrogenic things as well.
Yeah.
Now, speaking of lifting, you also offer something for women as well, which is less drastic than vaginoplasty. And earlier we were talking about that as well as restoring vaginal health. So I know we're talking about men's health, but can you please take a few moments before you close? What do you offer women?
So, I think men's health and women's health go hand in hand.
Absolutely.
And if you're in a healthy relationship, we have to address both. So we have men coming in for the UroLift for their prostates or the ED1000, and equally, women also suffer sexual dysfunction, whether it's laxity or looseness of the vagina or dryness related to menopause. So we have a new laser treatment called Incontilase or Intimalase, and it's where women come in for a very brief treatment of a laser in the vagina. And what it does is essentially resurfaces and replenishes the vaginal lining so that there's improved moisture. A lot of women after menopause have a dryness of the vagina. They have to take estrogen. And also it will tighten up the vagina for enhanced sexual satisfaction.
And for women who are terrified of hormonal stuff, this would be a great option for them.
So this is a total alternative for women having to take hormones within the vagina to replenish the lining, for example. So instead of taking Vagifem or Premarin, you can come in for a series of these laser treatments, and it'll accomplish the same thing without exposing your body to those hormones.
Awesome. And how many treatments, to the order of how many treatments with something like that?
3 treatments, a month apart, and that's it. And each one is less than half an hour. And just like the UroLift, you're in and out within half an hour with no preparation and no downtime afterwards.
And the elasticity is restored?
It restores the elasticity, it reduces sort of the entire canal diameter, and both women and their partners have reported improved sexual satisfaction and gratification.
That sounds amazing, and I'm really glad that you kind of cover both ends. One of the things that I often see when I counsel menopausal women is they'll think, I'm getting older, my partner's not interested in me, my vagina doesn't look or feel the way it once did, and they have no idea that maybe he's not approaching you because he's struggling with ED and he's really embarrassed about it. So they just kind of personalize it because they're getting older at the same time, but to talk about this stuff with someone like yourself, but also amongst each other, so that that maybe you're both struggling with your own stuff and it doesn't necessarily have anything to do with your partner not being attractive. Real quick, in 30 seconds or less, any final tips you want to leave our audience with on sexual health from a urology perspective?
Well, I think from a urology perspective, the important thing to say is if you're concerned, speak to your doctor, get a referral to a specialist, because some of these symptoms, like erectile dysfunction, could be an early warning sign of something much more serious. On the flip side of that, a lot of men are obsessed or really concerned about performance, whether it's time to ejaculation or how their penis looks or size. And again, there's not a lot that we can do about that, so we really have to learn to love ourselves, love our penises and how they work. And then lastly, there's a lot of great new treatments out there like the Gyro Lift and ED1000, and you should just look online and find places that are reputable and who'll be able to offer new treatments.
I'm so excited that you brought all these new treatments to us, because a lot of people haven't a clue that there is something that can be done, and I really hope that our audience reach out to you, because this is a lot more common than people realize. Thank you so much. We really appreciate you taking the time to speak with us today.
Thank you. It's been a pleasure to be here.
You've given us some remarkable insights and offer a lot of hope to men who tie so much into their virility that they become devastated by any signs of sexual dysfunction and are often too embarrassed to seek treatment that'll help them get their mojo back. Still ahead, an email on pageantry sex and special bedroom tips that'll put the play back in foreplay. In other words, really delicious stuff that you want to stick around for. Welcome back to Sex with Rebecca, geared towards making your relationships more robust than you ever thought possible. So send us your questions, and we'd love to bring you expert advice. Today's question is from Janine. After working hard all day, going to the gym, cooking and cleaning, I'm dead tired. But that's not to say that I don't want some nookie and cuddling. The problem is my husband turns that into such a huge production that it just can't be bothered. He wants me to dress up and role play, which is fine once in a while, but not every single time. So more often than not, I end up going upstairs before him and pretend to be asleep. It's killing our sex life, but I don't know what else to do. I mean, what's with that? Signed, Janine. Hey, Janine, I'm so glad you recognize how your response to his request is killing your sex life. And in a sense, you're missing the intimacy. Good sex is 90% in the brain and only 10% in the bod. So the right state of mind is crucial for the both of you. In his case, that means loads of mental foreplay, which is what role play really is. In your case, it's being able to relax, which is also crucial to the process. So the problem, as I see it, isn't so much him making a big deal out of it as it is ensuring that both your mental states are ready and eager. So let's look at it from all sides, shall we? The brain habituates very easily, so the same old stops feeling exciting after a while. Him wanting to spice it up is just his way of keeping it enticing and novel. At least he's not looking for novelty elsewhere. The other part of the puzzle could be, if you guys are stuck in a routine, he may need those role plays to get him going, which may not happen otherwise. What we crave gets hardwired into us between the ages of 5 to 8. If it's a schoolgirl outfit he's after, maybe his first crush, or for that matter, his first twinge of affection, involves a schoolgirl. If it's lingerie, outside of the fact that it makes most of us look pretty hot and bedroom ready, he could have satisfied his curiosity with the lingerie catalog as a boy with raging hormones. If it's something totally slutty, it could tie into fantasy where you're his porn star fulfilling his wishes. The point I'm trying to make is pageantry sex is just theater of the mind that engages the body. Now onto your side. I agree, if you're not relaxed, how in the world are you supposed to enjoy it? Plus, I can feel some resentment building up there. So let's get you both on the same page. You mentioned cooking and cleaning in the list of things that wipe you out. Tell him, if you want me to play dress up, you're going to have to take over cooking and or cleaning so I can gussy up for you while I still have some steam left in me. And steamy sex, as we all know, is uber hot. Who knows, you might even get a chance to soak in a bath and then have him wrap you up in a nice warm towel that he's heated up in the dryer for you. At that point, you can kick him out of the bathroom and pay him back for his efforts. You might just surprise yourself with how much fun you can have once you're nice and relaxed. Plus, when we're in character, we have to focus so our multitasking female mind doesn't get distracted like it normally can. I'm hoping my suggestions open up the doors to some crazy, nasty sex while some really naughty play. Once you've relaxed, of course. To our audience, if you have any questions of your own, do write us. We love your involvement. Speaking of which, if you enjoy the show, we'd really like you to subscribe to our YouTube channel. If we have enough people connecting with us there, we'll be uploading additional stuff that's too hot to be aired on TV. Still ahead, 10 good reasons for having sex. So stick around. Welcome back to Sex with Rebecca. Now, before we close, as promised, I'd like to give you 10 good reasons for having sex. Number 1, it releases a cocktail of feel-good hormones. Number 2, it enhances the immune system by 30%. Number 3, it allows us to mellow out, connect, and turn off fear, anxiety, and stress. Number 4, it rewires us to look fondly upon our partner. 5, it reduces depression and increases a sense of well-being, happiness, and euphoria. 6, it acts as a great pain reliever. So saying, "Not tonight, I have a headache," is in fact counterintuitive. 7, it puts the P back in partnership by feeding passion. Number 8, it slows down aging and makes us feel and look young. I'm about 1,000 years old, but you wouldn't know it just looking at me, would you? Kidding aside, it really works. Number 9, it protects women against heart disease, osteoporosis, and Alzheimer's disease, and men against prostate problems, which, as we've learned, are a serious concern. And finally, number 10, it promotes the connection that helps us live longer, healthier, happier lives. So there you have it. Hope you'll get busy, for medicinal reasons, of course. Thank you, viewers, for joining us tonight. Be sure to tune in again next week, and don't forget to email us your questions and subscribe to our YouTube channel to catch up on missed episodes, to watch your favorite shows again, and to access some hot stuff that can't be aired on TV. I'm Rebecca Rosenblat, your host, wishing you happy, healthy, and passionate relationships. Until next time.